Good morning. This is the Anchorage Emergency Operations Center operational update for June 23rd. These are pictures from the Juneteenth show from this past weekend. Situation overview. Go ahead.
Good morning. This is Luke Orrit, Situation Unit Leader here in the EOC. Today is day 476 of our response. As currently reported, locally are 112 cases since the last report a week ago, with no new deaths and 9 new hospitalizations. And statewide, up 227 cases, 0 deaths, and 12 hospitalizations. Next slide, please. For 213 resource requests, we filled or otherwise satisfied 1,768, an additional 2 since the last report, with 28 currently working. Next slide. In our congregate shelter, Sullivan, we have 299 clients. In the non-congregate shelters, 363 clients, up 26. That's 657 clients in all shelters, averaging 1,971 meals served per day. In the last week, at the visit testing sites, there were 1,263 sample collections performed. And in the last week, at all points of dispensing, 922 doses administered, with 79,180 to date. End report.
Thank you. Next up, weather. Go ahead.
Good morning, everyone. This is Michael Cutts with the National Weather Service office out at Sand Lake. Generally looking at mostly cloudy to cloudy skies over the course of the next week, with chances for showers, very little in the way of accumulation of rainfall. There will be some sunny breaks, but most of it will be under clouds and the sprinkles, as the case may be. Gusty southeast winds along Turnagain Arm and the higher elevations. Going to continue pretty much all week, lightening up for the weekend. And that concludes my briefing.
Thank you, Weather. Testings, vaccinations. Please go ahead.
Good morning, everybody. This is Pat Ryder, Emerging Infectious Disease Assistant Program Manager. Today with testing, Visit Healthcare had a decrease of 41.81% over the previous 7-day sample collections. As of June 22nd, our estimated daily growth rate is a decrease of 1.41%. Our 14-day average reproductive rate is 1.021. And our 14-day average case rate is 3.47 for every 100,000 inhabitants. Our current alert level is low. Per the CDC, testing for shelters and assisted living homes has been decreased to only once per month. Our positivity rates and case numbers are starting to increase slightly in the general public. There's no obvious increase in shelters and assisted living homes. With vaccines, Visit Healthcare clinics had a decrease in average daily vaccinations of 30% from the previous week. The Alaska Airlines Center Clinic will be closing down for vaccine distribution June 30th. We are currently looking for a new location. We are working with the Anchorage Chamber to provide gift card incentives to pop-up clinics. And for pop-up clinics this week, on Thursday, we have the Lusac Library and Secret Garden. On Friday, we have Turnagain Brewing, Muldoon Boys and Girls Club, and the Eagle River Block Party. On Saturday, we have Turnagain Brewing, Writer's Block, the Korean Alaska Friendship Day, and Eagle River Block Party. And on Sunday, we have the Backyard Barbecue event. Just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. Next slide, please. For messaging from the Anchorage Health Department, as mentioned, our overall risk level is low. This is evidenced by the fact that our current 14-day average is 3.47 cases per every 100,000 residents. That said, with over 54% of the eligible residences, ages 12 and over, having completed a COVID-19 vaccination series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average case count of approximately 4.5 for every 100,000 residents. This is in stark contrast to their vaccinated counterparts, who experience a risk equivalent to only 0.45 for every 100,000 residents. Also worth noting that while our current reproductive rate shifted upwards from the last week, our estimates may become more variable with cases only reported 3 times a week. Finally, we are continuing to watch the following community factors which may increase COVID-19 risk within the municipality of Anchorage. more transmissible variants of concern, continued light demand for new vaccinations, a reduced use of non-pharmacologic interventions, including masks and social distancing, despite more than half the population being vaccinated. And finally, there is an increased number of travelers to Alaska for both employment and tourism. This includes testing and vaccines. Barring any questions, end of report.
Tracks Logistics, go ahead.
Good morning. This is Wendy Reese, Contracts and Logistics, reporting the EOC. Currently, we're reviewing the contracts that went to the Assembly on June 22nd to determine the next steps, see which ones passed and which ones have not. COVID testing contract is out for bid as of June the 18th, and currently working with vaccination team requirements through HR and Personnel Plus contract, and working with purchasing, trying to get the funds encumbered on that contract so the VAC personnel can begin work. And just working on staff adjustments for the next 30, 60, 90 days as a result of the emergency order ending, and making those adjustments accordingly. End of report.
Thank you, ma'am. Finance, go ahead.
Good morning. This is Audrey Joe reporting for Finance. As of June 23rd, we have a current encumbrance of $18,534,278 with actual spent to date of $62,679,671 for a total expenditure plus encumbrance of $81,213,950. We're currently seeking cost recovery for expenses by way of federal funding. And as always, please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. End of report.
Thank you, Finance. Safety, go ahead.
Good morning, everyone. This is Public Works Safety Officer Aaron Carter, filling in for Annalise Roberts. I'd like to welcome everyone to week 4 of the National Safety Council's Safety Month. The NSC has provided 5 tips to help fine-tune not only safety, but just about any presentation. They are to know your audience, to be active, tell a funny story or two, think about the message you're sending, never give up, and try again. The NSC would also like to remind us that safety is everyone's responsibility, and we should all have a seat at the table, no matter what our positions are. We can accomplish this by good communication lines, having an open door policy, ensuring access to proper safety equipment, and a team effort is needed to build a strong safety culture. For more safety info, please visit nsc.org. Thank you very much. End of report.
Thank you, Safety. Public information, please go ahead.
Hi, everybody. This is Laura Atwood. I am filling in for Heather Orono, who is on leave this week. So public information is continuing to promote all of those great pop-up clinics happening around town. You see the list there: Lusac Library, Turn Again Brewing, Eagle River Block Party, and more. We are also continuing outreach to businesses and organizations to host more vaccination clinics. Working on graphics for an upcoming event happening this Saturday, June 26th, the Korea-Alaska Friendship Festival, which will be at the Diamond Center, and we will have a booth there, be talking to people about the importance of getting vaccinated if they're not already vaccinated. Also working on return to work resources that will be added to the Health Department, Anchorage Health Department website and for social media. So those are just a few of the things that we have going on, and we are just continuing to reach out to our community and promote vaccination and testing. End of report.
Thank you, ma'am. Liaison Officer, go ahead.
Good morning. This is Celeste Prescott, Liaison Officer for the EOC. I'd like to thank all of our partners who were able to join us today. Does anyone have a report out at this time? Okay, hearing none, we'll go right into our hospitals. And I believe, is Kirsten on for Alaska Native Medical Center?
Good morning, this is Kirsten at ANMC. Today in the hospital, we have one positive. That patient is in the CCU, but not ventilated, and we have 0 PUIs.
Great, thank you, Kirsten. And Sean is on for Alaska Regional Hospital.
Good morning. Alaska Regional Hospital currently has 2 COVID positive patients, one of whom is recovering, and 2 PUIs.
Thank you, Sean. And was Nikki able to join us with Providence Alaska Medical Center?
Yes, good morning. Today we have 7 COVID positive patients, 3 in ICU, 3 on mechanical ventilation, and 2 COVID recovered. Thank you.
Thank you, Nikki. And Matsu Regional Medical Center, is Kara on?
Good morning, Kara Cahill with Matsu Regional Medical Center. Currently have 2 positive COVID, 2 PUIs, 0 in the ICU, and 0 on vents. Thank you.
Thank you, Kara. And was Sergeant Perez or anyone else able to join us from the 673rd Medical Group? All right, looks like they were unable to join us again today. That's all for liaison. Thank you.
Thank you, ma'am. Our next operational update brief will be June 30th at 10 a.m. Everybody have a great day. Get outside and enjoy the weather.